I'm Shawn McLaren. I'm the Chief Learning Officer for St. John Ambulance Canada. Canada is facing a really serious health crisis, and one that we're focusing on greatly within St. John Ambulance Canada, one we put a lot of effort into, and one that is affecting every corner of our country. What I'm talking about is an opioid crisis. Since the data was first starting to be tracked, which is just in 2016, Canada has lost 34,455 people to accidental opioid poisonings. This is a staggering number for our population. It is probably the most important public health crisis that we're facing right now. Through 2022, we were losing 21 people a day to accidental opioid poisonings. And why do I say accidental and why do I say poisoning? These are not people that are taking too much of a substance. These are people that are taking a substance they weren't expecting. And someone who is trying to manage their pain through a regular dose of opioids has had their prescription cut off and has had to go to the street to get their supply, and this supply is tainted and the supply is toxic. So someone that would have been taking a regular dose now has fentanyl or carfentanil mixed into that prescription, mixed into that pill, and they are taking something they didn't expect. So now their body is being poisoned. And whereas, again, this was a regular dose that they've been using for some time to manage their pain or manage other issues, is now toxic. And they are put into this position where they are now poisoned, and that poison is causing their death. And a lot of times people are using alone, unknown to their partners, to their families, and they're dying alone in their homes, in their bathrooms, in their workplaces, because no one knew they were using. So St. John Ambulance, beginning in 2018, took it upon ourselves to try and fight this crisis. It started with us introducing a 30-minute part of all of our first aid classes that introduced people to what was happening. We talked about the crisis, the public health crisis, the opioid crisis. We spoke about awareness. We spoke about who this was affecting. And that's one of the biggest hurdles that we've had to face in terms of who this is affecting. People have a stereotype of who uses drugs and why they use drugs, and then they don't want to get involved. It involves stigma, it involves criticism, it involves judgment. And what we're really trying to do is bring people to a level of awareness of who is using and trying to combat that judgment and trying to get the right tools into the communities that need it the most. But that comes with the general public not passing judgment and having an understanding of who is using. As a quick statistic, when we talk about the stats from 2022, about 75% of all the accidental poisoning deaths were men between the ages of 19 and 49. And of that percentage, about 65% of those people were young men in the trades. So this is not the typical person that someone thinks that is making choices about substance use. This is someone that's having to manage pain, has had to go to an illicit supply, and is dying because their supply that they're used to using is now toxic and is mixed with fentanyl and carfentanil. Carfentanil, if you're not aware of carfentanil, is what they use to sedate elephants and horses and large animals. And this is being mixed into a drug supply. You can't taste it, you can't smell it, you don't know it's there. And thus, that's why we call it a poisoning, because it's a chaotic use of the drugs that is unknown to the user. So after we included opioid awareness training into all of our first aid classes, we started to work with our federal government in terms of securing grants and funding to combat the crisis on another level. We recognized that there was a need to get training and support in the distribution of naloxone, which is an antidote, and we don't get to say that very often. But as naloxone goes in, removes the opioids and lets the person start to function again and breathe again, and that's what reverses it and saves life. So we saw a need to get naloxone and training into communities that needed the most. So we worked with our federal government, with Health Canada, on 4 different programs, which are still ongoing. The first was what we call our Reaching Home program. And this is a program that's centered on work with volunteers and employees are supporting people experiencing homelessness, so the homeless sector, because they are proportionally more apt to suffer a poisoning than others. So we get training in naloxone into that community. A second program we work on is called our Underserved program, where Health Canada has asked us to identify underserved communities across the country. And what this entails is remote and isolated communities, our Indigenous communities, but also what people don't typically expect is our construction and trades communities, which again are using opioids to manage pain. When their prescriptions end, they still need to work, and they go to an illicit supply, which again is laced with fentanyl and carfentanil. Our third program is what we call our Community of Practice. And what this one does is links organizations across the country together in monthly discussions, what we call summits, to talk about the challenges they're facing and how they can help others across the country overcome the challenges that they're facing. This is very well attended and is growing and growing and growing. We had our very first in-person summit, which we intend to have more. Our last program is what we call our Ontario Workplace Naloxone Training. And what's remarkable about this and what's really important about this is Ontario has been the first province to mandate, to legislate that workplaces need what we're calling a naloxone first aider. So they're saying that a community or a business that is at risk of having someone experience a poisoning on their premises needs to have people trained within that workforce and naloxone kits on premises. It is a remarkable step forward. It is an important step forward and one we hope to see replicated across the country, and that's why we want to be involved. In terms of the core of what our training does, and this is a really important part, it's not just about the application of naloxone and a reversal of that poisoning. There's 4 parts to what we do. We start with stigma, and we need to break the stigma. We need to make people understand and open their eyes as to who is at risk of experiencing poisoning. And the short of it is, it's everyone. We then talk about harm reduction, and we talk about what harm reduction is. Just talking about it, watching this video, you're participating in harm reduction. The more we talk, the more people understand. Then we do move into how to properly apply naloxone in the reversal. And then we have a last section on self-care to make sure that people who are involved in reversal, either successful or unsuccessful, are taking care of themselves. Because this entire crisis isn't just about having naloxone on hand and applying it when someone's in a reversal. It's about the willingness to act. And people have to have the willingness to act, or the lives won't be saved. We're very proud to say that to date, we have distributed over 50,000 naloxone kits into the communities that need them the most, and putting them in the hands of people that are saving lives. And we've saved countless lives with this effort, and we're going to keep going until the crisis is over.